Hi, my name is Kat Villanueva.
And I'm Ryan Miner.
We are the hosts of the Copy and Care podcast, where Ryan and I unwind America's vast and complex healthcare system and explore the care continuum cycle. These podcasts will explore the latest trending healthcare topics and the concepts of care that most of us experience in our lifetime. Before you sit back and relax, grab your favorite mug and be sure to brew your favorite cup of coffee.
This is episode 3, featuring
Cres, Rodrigazo-Manansala.
She's a registered nurse and the George Washington University Hospital Stroke Program Coordinator. May is National Stroke Awareness Month, and Kat's passion and expertise is caring for stroke patients. Mary, welcome to Coffee and Care podcast for the very first time.
Hi, thank you for inviting me.
Hi, welcome Mary. It's really a great pleasure and thank you so much for allowing us to do this with you. I know in our hearts, stroke is really, near and dear to our hearts, and so thank you so much for your time today. Ryan, if you don't know, Mary and I, we are actually both professional and personal friends. So
I gathered that.
Yeah, so we've spent, a few New Year's Eves together in the past.
What'd you have to drink? Coffee?
I don't even remember. It felt like it's forever. It's been forever. But yeah, so Mary, thank you so much. And I know that your time is limited today, so we're going to go, straight to what we want to talk about today. And let's start with, can you share with us your role as a stroke program coordinator at GW, and how long have you been doing this?
Well, I've been in GW for over about 22 years now, and has been the stroke coordinator for about 14 years, since the beginning of our program in 2007. My main role is mostly coordination to oversee the overall operation and the stroke program on a daily basis, and I usually do some coordination, organize meetings, communicate important information of the program and to all of the units involved, and ensures, of course, patient safety, and then that meets and exceeds the national quality standards for our patients, for our stroke patients.
Wow, 13, was it 13 years, right? Is my math okay? Right. 13 years, is that right, Mary?
14 years.
14,
yeah.
wow, that's a long time.
I got in this business to help people into market and healthcare, and when they said math, I ran the opposite direction. So, Mary, you have so much experience, you and Kat. May is National Stroke Awareness Month. My question to you is, how can we as healthcare providers, home care providers like Nest and Care, and of course yourself, educate the community at large about the warning signs, the symptoms, and taking preventative measures to curtail some of the risk factors and the lead up to a stroke?
Well, stroke is the leading cause of death and disability in the United States. So GW Stroke Program is committed to reach out to the community through education and knowing the signs and symptoms of stroke and the risk factors for stroke. So we do our community outreach through health fairs throughout the city, actually. We also conduct one here in the Foggy Bottom Metro every year in May during the stroke month, with the exception, of course, of the past 2 years because of COVID. So we do some blood pressure screenings, blood sugar checks, all those risk factors. We talk to all the community that comes, and also we do some BMI checks and many, many more. And as a stroke coordinator, I usually oversee all of the stroke outreach on behalf of the GW.
So Mary does a really good job organizing, and she's very good at organizing all of these events. We've been part of, different events as well. She's still part of the DC Stroke Collaborative, where the different hospitals and including American Heart Association and the DC Fire EMS, they usually come together and plan for all of these events to serve the community and to see what is the best practices in stroke care and treatment. Definitely a lot of community education is important when, trying to make sure that our community is, educated.
Yeah, I've learned so much in the last month about stroke awareness, about the signs and symptoms. And of course, we are all familiar with FAST. Mary, what does FAST mean? What does that acronym contend for when someone is either experiencing the symptoms of a stroke or when someone who is with a friend or a family member, it's an acronym for them to quickly remember to identify the signs and symptoms of a stroke. What does FAST mean?
The key is early actions is important for stroke. So knowing your signs and symptoms of stroke is key. So like we call it, usually American Heart Association is actually promoting this because it says time is brain. The reason is knowing the signs and symptoms is key. The F stands for facial droop. Again, the key is sudden. So it means that you were normal before and suddenly you're having this symptom. So again, just sudden is the key word. So as a facial droop, suddenly your face suddenly is having one side of your face is suddenly drooping. And then A is for arm drift. So arm drift means one of your side of your body is suddenly like you're dragging your feet, or your one arm of your body or your side of your arm is like going down, or you can't lift it up. And then S is for slurred speech. This is actually very important. Suddenly you're talking normal and suddenly somebody's having some weird talking, like he can't say the words or she's slurring words. So those when you call it slurring of your speech. And T stands for time. Time to call 911. The key is do not call anybody, do not call your daughter, do not call any of your granddaughter or whatever. Call 911, please. The reason being is calling 911 can help you start the process that could take you to a stroke hospital that can help you, because the only place that can help you or treat you is in the hospital. There are treatments, however, at the doctor's office, it's in the hospital. That's the key.
Yeah, so absolutely calling 911. And as we are now taking care of people in their homes, we've seen quite a few families or some of our clients would say, oh, like I have this, sudden onset weakness or something like that. And they would call their family member, or they would just ask someone to drive them to the hospital because they live 2 minutes away from the hospital and they feel like it's faster for them to get to the hospital. How would you respond to that?
So again, because not all hospitals are stroke certified, but we're fortunate actually in our metropolitan area, most of our hospitals are actually stroke certified, even to the lowest one, even a primary stroke center or acute ready hospital. So that's good news to us, actually, to the community. However, the key is really calling 911, because if there are certain types of stroke, and if you're having more than just a minor stroke or a large stroke, it makes a big difference in terms of where they're going to take you. Again, calling 911 can help you take you to the important designation that you needed in terms of treating you with acute stroke.
We know what a stroke is, but for people who may not understand what the physical consequences are of a stroke, meaning what happens in the brain, Kat, Mary, can you walk us through when someone is having a stroke, what happens to the body?
In a simple explanation, the signs and symptoms of stroke actually can tell you already, like very simple, even question about, hey, do you know where you are right now? Can you tell me your name? Or can you tell me what's the date today? These are simple questions that usually will let us know, but the biggest questions that we usually ask are the signs, again, and symptoms of stroke. Knowing the FAST is very important. When you're having those symptoms, something inside your brain is wrong. That means that there's a clot that's inside your brain, or sometimes a hemorrhage. So there's two types of stroke, which is ischemic stroke, which is there's a clot inside your brain, or you can have even a hemorrhage, which is a sudden burst of vessel inside your brain that just blew up. So those are the two signs of stroke, the types of stroke, and you needed to go to the nearest emergency room so that they can treat you whichever it is. That's usually...
I think that that's really important to know as well. Calling 911, could you walk us to, what happens after 911 is called if there is a potential stroke patient? They call 911, they get to the emergency room. Can you walk us through like high-level overview of what happens inside the hospital?
So inside the hospital, the reason why also 911 is important, because the ambulance usually calls ahead. So usually they will call ahead to the hospital saying that, hey, we have a potential stroke, And then what it does, even before the patient arrives in front of our door in the emergency room, there's a team that activates it. So usually they will call the operator and activates the whole team that designated to stroke alone, and then we are usually there before even the patient arrived in the emergency room. So what we do is we usually wait for the patient, and then once the patient arrives, the stroke team immediately assess the patient. And then after like 5 minutes after registration, it's just less than 5 minutes, we go straight to the CT scan, and that's where we go look at the patient to make sure that if the patient has hemorrhage or not. And then with that, at the same time, the doctor or the provider also assess the patient using the NHS stroke scale. And then with that, also asking questions about what happened exactly, what are the, before it happened, asking exact time when it happened. And then if the patient is eligible to take the treatment, which is one of the treatment is actually the IV out of place, or TPA, what we call it, called a clot busting medication. But there's like a lot of consideration that we have to do before we even give it. And you only have a window of time, which is like 60 minutes by the time they came in, or 3 hours by the time they started their symptoms. So again, time is the key here. So that's what we do. Then we identify if the patient is to get this type of medication, IV drug, or can escalate it to a more advanced care, which is either your thrombectomy or either way, or ICU, or if the patient has hemorrhage, then call another team, which is your neurosurgery, to take care of this type of.
And Ryan, it's really important. So when you talk about stroke, and correct me, Mary, if I'm wrong, it's been 2 years. But really, there are a few things that are really important in stroke and, like management or how you deal with it. So knowing fast is like one of the important things that the community should be aware of. The first thing that the hospital would ask, or even the EMT, the ambulance would ask, is when did this start? So they want the exact time. Is it 3:10? Is it 3 o'clock? Is it 3:30? They need the exact time of when it was first noticed.
Is that so that they can quickly assess how much time has elapsed since this has occurred, because that gives them a window into treatment options?
Yes, exactly. Is it 3 hours or 4.5? What is the standard now? 4.5 hours?
The FDA approved it for 3 hours, but the American Heart Association actually extended that window to 4.5 hours for the IV treatment, which is your IV out. However, there are new treatments right now in which they extended the window. However, these are only hospitals that have the capability of doing that, which is if it's a comprehensive stroke center like GW, for example, or thrombectomy-capable hospitals that has the ability to actually get inside your brain and take out the clot manually, which we call them thrombectomy. So that window extends up to even 24 hours. But again, it's a case-to-case basis again, and then it depends on all of the providers, because there are neurology involved, there are neurosurgery involved, or there are interventionalists involved. So there are a group of specialists who usually looks at patient scans or imaging to decide if this patient is actually can be treated into a further treatment.
I have a question for both of you. Since May is National Stroke Awareness Month, not only are we learning how to look at the symptoms and identify them quickly, and to help people understand the necessity of calling 911 immediately and getting them into medical treatment. Also, we're talking about how to take preventative measures and steps, because, of course, much of our healthcare system today is learning what not to do, what not to eat, what not to drink, what kind of foods that we should eat that are healthier. Tell us some of the activities, Kat and Mary, that you absolutely should begin now if you haven't already begun. What preventative measures to take, and what actions, as we humans like to indulge on certain things, what should you stop doing in order to increase the likelihood that you will not have a stroke in the future?
I'm going to start, Mary, and then you could maybe follow. But I think with your question, the first thing that you need to know is, what is your risk? What are your risk factors for stroke? Once you know your risk factors, then you know how you can manage that effectively so that it lowers your risk for having a stroke now or later in life. So with that, Mary, could you walk us through, some of the major risk factors that you see in your patients that had stroke?
Knowing your risk factor is the key here. So some of the major risk factors for stroke are actually high blood pressure is number one, high cholesterol. If you have diabetes, smoking is also one of the risk factors. Obesity, atrial fibrillation, something is wrong with your heart there. And then, of course, I'm sorry to say, if you have a family history of stroke, then you are also at risk. So, and also age is a factor too. So, unfortunately, the older we get, the higher we get risk of having a stroke. Unfortunately, so there are only, I think, 3 keys or stakes that I wanted to get it out there, information-wise. Is first, knowing your risk factors is the key. Second, if you have all these risk factors, please, please, please go to your primary doctor, because all these risk factors can be manageable. Like your high blood pressure, for example, your primary doctor can give you some medication that can actually help you lower or normalize your blood pressure or maintaining it. Lastly, knowing the signs and symptoms of stroke. So again, if you're in doubt of all these risk factors, go to this website, American Heart Association, Life Simple 7. Go to this website and get more information, because usually it will tell you exactly how to manage all these risk factors and can be still healthy and live a long and healthy.
So quit smoking. If you're smoking now, no smoking. What about cigars? I like an occasional cigar. Should I quit that? Okay.
Mary will not advocate for that.
She will not advocate. I'm not saying anything. Kat, people who are obese, is that also a risk factor?
It's definitely a risk factor. It's hard, like if you're obese and you get to like this certain weight, it's hard for someone to lose weight. I think that's like the hardest, right? Because there's really like no medicine unless, there's nothing that you can take to just
lose weight.
Yeah. But the key here is that you set realistic goals. If you have a sedentary lifestyle and really knowing what you're like, if you're obese and that's your risk factor, really knowing what your capabilities are, what can you do to combat that, to control that. Set a goal for yourself on a daily basis. Maybe you start by walking around the block. You don't have to go to the gym and start like doing all of those, like doing the treadmill and the bike. And I don't go to the gym, so but so just really like making very we're busy making very simple goals that are really attainable. And then once you attain that, then you increase it. Don't set yourself up for failure by saying, okay, I'm obese, I'm going to take control of my life, and I'm going to run the marathon right away. Like, be realistic. That's the key.
Realistic expectations, setting goals that are achievable. So just starting out to reduce the risk, even when you're at a higher risk. Basic activities like taking a walk and going out of the backyard. If you have animals, dogs, you walk the dog at night. What about diet? What can you do to change your diet? I know that can play in with, of course, obesity. What are those simple tweaks in the diet that will help someone reduce the risk factors in having a stroke?
Yeah, well, one example is if you have high blood pressure, again, like knowing your risk factors, what you have. So, for example, if you have hypertension, so of course you have to reduce eating meats, all the sodium, for example, intake. You have to be very careful on those. And then if you have diabetes, for example, and you have to have a really balanced diet, you cannot eat a lot of sweets, a lot of those things and stuff. The key is controlling in both. Controlling your blood pressure, your hypertension, controlling your diabetes. Going to the doctor is very important if you have all of this, because they need to look at this and look at the trends. If you're doing well, if you're doing not or not, checking your A1C every now and then to make sure that you're in that level. These are all preventable risk factors and also maintainable, so that's the key. That's just my take in terms of that, in terms of food intake. The American Heart Association website can help you maintain that goal, and a lot of information is there on how to maintain that weight, how to maintain that sugar level that you need to, again, in order for us to maintain a healthy lifestyle. That's the key. Balanced lifestyle and small goals.
You mentioned something that sort of made me think trends, right? First, I think that you take control of your risk factor. If I know that I have hypertension, you bet I'm going to have a blood pressure machine at home. It's not expensive. It's $20. You monitor your blood pressure on a daily basis. You trend it, you log it, and on your next appointment, show it to your physician. Then they will know exactly where you are on a daily basis. Because if you see your doctor every 6 months and they get that one blood pressure, it doesn't really show the big picture. But giving them your trend, as long as you take it at the same time each day, I think will give your physician a better grasp of your condition on a daily basis, and they could give you the right dose of medication to control your blood pressure. And same thing with having diabetes, checking your glucose, just being proactive and taking control of your risk factor is definitely important.
We're going to take a quick break and we'll be right back. Everyone deserves access to affordable and high-quality healthcare. That's why Nest and Care is dedicated to empowering your loved ones or yourself to maintain their independence for as long as possible by providing personal and companion care services, neurocare programs from Alzheimer's and dementia care to stroke and Parkinson's care. Nest and Care also offers several specialty home care programs as well as skilled nursing services. Nest and Care offers personal hygiene assistance, medication reminders, stroke care. We also offer non-medical transportation and other personalized care programs that cater to yours or your loved one's specific needs. So call us today at 240-690-9900 to begin your care journey with one of Maryland's best and leading home care providers. And today we're talking all about strokes, how to prevent them. I'm interested in learning, okay, you have the stroke, and unfortunately now you do have the symptoms. You do suffer some fallout and some medical issues now. Your speech might be slurred. You have other conditions. Kat and Mary, what do you do? How can you reach out to certain healthcare providers? What are the steps to take to recover from that?
I think that's the hardest thing. Like when I was still a stroke program coordinator for a hospital in DC, discharge planning, it's really something that's just hard to do because especially for someone that has severely disabled, they would either go to a long-term care facility, or if they want to stay home and age in place, then there has to be a designated sort of family member to take care of them and take care of their activities of daily living, still enjoy a good quality of life. A lot of families have always struggled with that. And so that's when home care agencies like Nest and Care comes into play, where we're able to provide those personal care services to the patients and to the clients. When you're discharging out of a hospital, you had this like really debilitating stroke, identifying someone in your family to help you out is the key. What is your experience, Mary, in when you discharge someone and they don't want to go to a long-term care facility, they want to go home? Has that been like sort of a struggle for you, for the discharge team and the family?
Yes, of course, definitely, because every stroke, again, is not the same and it's different. And most stroke survivors actually have the goal of returning to live independently at home. Of course, if they have the ability to do that, they would prefer from home, right? That's right. Usually the context of your home. So people who have a stroke need a safe, healthy, structured environment, and some families are able to provide this at home. What you actually offer is a great opportunity for other families and stroke survivors who have that ability to stay home. So that's actually, it was nice of you to have that ability to take care of them while they're home. Coordination is part of what we do as a comprehensive stroke. Our job doesn't stop when they just discharge from our hospital. It does not. So what we do as a stroke program coordinator, or even a program actually while they're here in the hospital, we actually meet at 11 o'clock. We gather all of the multidisciplinary team actually gathers with the physical therapist, their social worker, case manager, nurses, providers, dietitian. Can you just imagine one stroke patient takes care of multidisciplinary team? Pharmacists are there too. Talking about the medications to make sure that it's safe or anything like that. It's a multidisciplinary team who takes care of this patient and also helping and planning when can this patient, the goal is when can this patient go home safely, what are the patient's needs, and then the moment that the patient is out of this hospital, then we still call them 2 days after, 7 days after their discharge, 30 days after, or even up to 90 days after the discharge. Our job doesn't stop there. We usually follow up with these patients up to 90 to a year, actually. That's what we do here, Comprehensive Center.
And you're following up to find out, are they still taking their medications? Are they going to their doctors for follow-ups and things like that?
Correct, yeah. So we usually making sure if they have problems with their medication, our providers can usually immediately call the pharmacist. So those are the little things that really matters for stroke patients. Because again, they're already suffering for stroke, and they more concentrate on what they needed to recover, right? So at least the least we can do is help them out in terms of their following up with their physicians, for their primary doctors, for their either neurologists again or stroke doctors. So these are the things that we do and help them if they have questions about their diet, they have their questions about they need more physical therapy and all. Those are the things that we usually we do to prevent them from having another stroke. So that is really the main goal. The main goal once they're discharged is for them not to have another stroke. It's usually our job here at GW.
I have a question about medication. Are there specific medications that help prevent stroke or reduce the risks?
Yes, your primary doctor will just not give you the basic medications that you usually need. They will also give you some medications that will prevent you from having another stroke. So you might have more medications. This is only through your provider. So you need to really seek your provider in order for you to know what medications. Every stroke is different and every patient is different according to their needs. So you just have to follow up with your primary doctor.
What about speech issues that are impacted? That seems like it's the recognizable signs of a stroke. My great-grandfather, back in the early 90s, when he was still alive, he had a stroke that was pretty debilitating, as well as my great-grandmother on my mother's side. She had a stroke, and then she was then moved to an assisted living community in Williamsport, Maryland. My great-grandfather he had care at home. The speech portion was deeply impacted. I remember at that time, they didn't do too much about it. It was very difficult to communicate with what can be done in the aftermath when someone's speech is impacted as such, when they really have difficulties communicating with friends and relatives.
Here in GW, before even the patient is discharged, it's required our rehabilitation team to see the patient. So that involves physical therapy, occupational therapy, and especially speech therapy. It's usually a standard of care here for us to see them, to see each of these patients, and to make sure and evaluate actually if there's some needs for this patient. Case managers or social workers usually arrange all those things if according to what the speech therapist or PT and OT recommending usually, and they need further care or they need further therapy and stuff. So they arrange all of that before they even go home. They cannot go home without all these things. So that's actually good news now to our stroke patients. Before, I remember maybe 30 years, 20 years before, there's no treatment in terms of speech treatment. So there are now some situations that you can see the big difference on the patient's life, especially for stroke survivor. They even, like, sometimes I see some of our stroke survivors recover from even speech impediment. Before they come in here, they cannot talk, and then 3 months, 6 months in a row, then we can talk to them on the phone, and they speak a little better. Good physical therapy, occupational therapy, and speech therapy after stroke is really the key of recovering actually from stroke.
To just emphasize what Mary said, typically if we're talking just about speech, they will be followed by speech therapists. So that will be arranged before they get discharged. So home speech therapy. I've met so many stroke patients, and even in our industry, they're 2 years out of stroke, but they're still continuing their therapy because they've seen such great improvement. And I know at some insurance stops paying for it, but if the family is able to get their own physical therapy privately or speech therapist privately, then that's what they do so that they can continue improving. Mary, this is a question that comes up a lot. At what point is it that therapy is no longer effective? So you get out of the hospital, you had a stroke, let's say January, and I didn't do any therapy, or I did maybe a month of therapy and then I stopped. And now I'm like 7 months in, 6 months in, and now I feel like I'm ready to take over my life and start over. Is that still going to work for me?
Every recovery is different from every patient. Again, there's a lot of factors involved in patient's recovery. Family factors are also implied in there too, on how your family is involved in your care, or if you have the resources also in order to get that. Some other patients would get resources from, for example, if they're doing physical therapy or speech therapy right now, your speech therapist will give you a lot of exercises, and if you can't do it anymore, if your insurance can't do it anymore, just ask some information in there for her for you to continue doing whatever that the speech therapist is doing. And then always following up with your primary doctor is the key. Your primary doctor can still give you some advices, some medical advices, or if you still need that, or if you don't. The key really is following up with your doctor to make sure that if you can also reach out from your doctor and see if you can get more resources from them. If they can give you more resources.
There's a lot of support groups as well. Support groups and other nonprofit organizations that actually cater to stroke survivors, right? And especially the ones that are not able to afford their group therapies that they could tap into. And we should have that actually as a resource in our website, so that our clients or potential clients can look into that as well. Do you provide any support groups over at GW, Mary?
We do have our support group every month here in GW. It used to be we have the in-person support group, but since COVID, we are actually started doing the virtual stroke support group that was actually successful. We just started it about 3-4 months ago, and it's every second Tuesday of the month. I can send you the link, so you guys, if ever they needed some resources, they can actually do that. So we do have a stroke support group. We have speakers usually prepared for them every month, and we have a lot of educational, things that we talk about there in our support group. So I can send you the link.
Yeah, absolutely. I think we can, if you're okay with putting it in our resources page in our website, I think that would be a great resource for people that are looking for support. It's not easy, right? It's forever. I guess it'll get better if you get therapy early on and rehab. At some point, there's going to be a plateau. A lot of people will need some sort of, encouragement and motivation and support. So that would be really good for our stroke survivors and their families. I just wanted to know, GW Hospital is such an exceptional hospital. You know me, I've always wanted to work there. You've built an incredible program. It's one of the best programs in the area, if not in the nation. I just wanted you to give our listeners a little bit of what makes the GW stroke program different from other hospitals.
Well, like I said before, not all stroke are the same. So there are some strokes that are small and some stroke are big. And what's unique about GW is, as a comprehensive stroke program, is we have the ability to take care of more complex stroke patients, which means that if the patient has a big clot or a big stroke, so that IV out of place cannot dissolve that clot. So we have actually the expertise, and highly trained doctors are capable to perform these type of procedures, so which is the thrombectomy, like I was telling you about. So what they do is they go inside your brain and manually take out the clot. So again, as a conference center, we also have the neuro ICU capability 24/7. We have a neurosurgery capability. They are available 24/7 for patients, 20% of our stroke patients who have the hemorrhagic strokes, for example. And of course, we have the advanced neuroimaging capability. That's very, very important. So aside from our CT scans, MRI, we have this other advanced capabilities, rapid, for example. We have that capability to look at the patients inside their brain and actually see what's going on inside their brain. So that's what separates us actually from just the primary stroke centers or other thrombectomy stroke centers. So we are a comprehensive, which means that we have that ability to take care of that more complex case.
GW University Hospital has a comprehensive stroke program, and they're designated by the Joint Commission. You know that the quality is there.
Top notch.
Top notch. Yeah. What more can you ask for, right? Thank you, Mary. I appreciate your time today. I just wanted to do like a very quick recap of what we learned today. I think it's really important to like just do a major takeaway. There's two types of stroke. It's a ischemic stroke where there's a clot in your brain, which is the more common type of stroke. The second type of stroke is hemorrhagic, comprises of about 20% of strokes, and hemorrhagic stroke meaning bleeding in the brain, a broken vessel. And then we learned about the signs and symptoms of stroke, and the best way to remember this is the acronym FAST. F is for facial droop. One side of your face is drooping, and the key word, like Mary mentioned earlier, is sudden. It has to happen suddenly. A is for arm weakness. So you hold up your arm and it just like falls, or it's weak. Or it could be a leg too, like if you have weakness in one leg. And then S is for slurred speech. So you ask someone to say the sky is blue and they're not able to say it correctly. Or they can't say anything at all. They're completely aphasic is what the term they use. T is it's time to call 911. And with this, make sure that you really call 911 even if you're like 2 minutes away from the hospital, because the EMS that'll come and help you out, they will call the hospital and then they will activate the code stroke team or the brain attack team. And so by the time you get to the hospital, the whole team is ready for you. And there's no time wasted, because time is really important when we're talking about stroke. In terms of treatment, we learned that the hospital can give IV alteplase, or what we call IV TPA, within the first 3 to 4.5 hours of your stroke symptoms onset. So you need to know exactly what time your symptoms started. The risk of giving that medication beyond that time is bleeding in your brain. Yeah. So that's why it's really important to have or to know that time. And then the second treatment or advanced treatment that not all hospitals have this capability, but GW has this capability, is thrombectomy. Thrombectomy is simply putting a catheter from your groin and threading it up to your brain and then pulling out the clot manually. That is only done on large arteries. So those are the two main treatments for stroke. And really the history of the treatment of stroke, it only started in 1995 when TPA was first approved. So before that, it was nothing. There was no treatment. Controlling your risk factors, and some of the major risk factors that Mary talked about is hypertension, diabetes, obesity, smoking, high cholesterol, family history of stroke. Unfortunately, that's not something that we can control. Knowing that in our mind, it'll make us a little bit more careful with our lifestyle.
It's really important that the whole community at large get together and figure out different ways to offer our expertise to help people, to identify those risk factors, and to help people live happier and, of course, healthier lives. All of us can live a healthier life and take these preventative steps to be more educated, a better diet, and a little bit more exercise. And I'm really proud to be part of this organization, because Kat, in the time that I've been here, has taught me so much about what stroke is and how to take the steps to prevent it and how to get help when needed. So I'm really glad we did this, and I'm really glad that I had the opportunity to talk with Mary and to learn so much from you and from Kat. I'm learning so much, and I can't wait to share this information with other people and to help continue to educate.
Yes, absolutely. Thank you, Ryan. And thank you, Mary. I can't even tell you, I truly appreciate your time. I know you're super busy. And so we're gonna let you get back to the ER or wherever, ICU, wherever you're working.
I have my eye here at 11.
This is really fun.
Thank you for having me.
Thank you so much. And we'll talk soon.
Sure.
Okay.
Thank you, Ryan. Thanks, Kat. Thank you for having me.
Thank you. Great to see you. Thank you for listening to the Coffee and Care podcast. Be sure to check out Coffee and Care at nestandcare.com/podcast, where you can listen to all of the latest podcast episodes. Of course, this is podcast episode 3 under our belt already, Kat. You can subscribe to the Coffee and Care podcast on Apple Podcasts, Spotify, Google Podcasts, Stitcher, TuneIn, Podbean,
Amazon Music, iHeartRadio, CastBox, and over. And please let us know if we missed any of your favorite podcast directories. And of course, we'll get that updated immediately.
We'd love to hear your feedback about the latest episode. Email us at podcast@nestandcare.com or text us at 240-690-9922. You can also leave us a review on Apple Podcasts or wherever you listen to your podcasts. Do you want to be a guest on the Coffee and Care podcast? We would love to have you. Email us at podcast@nestandcare.com. Until next time, keep the coffee fresh and bold.